This is a new way of treating AAAs. I'm sure a lot of sonographers here have seen endovascular repairs and scanned them routinely looking for endoleaks and other problems. We'll sort of skip through the traditional repair. We've all seen those. The usual EVAR scans, the fenestrated EVARs. Dr. Gray, who I work with, has these cool P branch ones that has a little movable renal artery stent that can be almost off the shelf for a lot of these patients. But there's a new way of treating them, hopefully to solve a lot of the complications that are seen in the traditional EVAR, from the endoleaks to lymph thrombosis and kinking and further aneurysmal disease, and that is to prevent endoleaks. We've all seen endoleaks before. Routinely, Dr. Peter Bray will coil off the IMA a few days before he puts the EVAR graft in to reduce the risk of an IMA endoleak. But this is a new way of doing it to prevent endoleak. It's called the Neelix repair graft, and you can see here that there's two stents extending all the way from just below the level of the renal arteries into the common iliac arteries. So there's no trouser appearance, they're just two straight grafts. And they have these cool balloons that are part of the graft. And so you can see here they'll access a vessel as they usually do, put a couple of wires up, feed up the stents, and stents are inflated, and then they pump full these balloons of a special polymer. It's almost like I don't know if any of you have done home improvements before, where you use that polyfill stuff, that spray foam that expands. It's basically that. I've played with it. It's a little bit more rubbery than that, but essentially they fill up these bags full of this fill, and it fills up the lumen of the aneurysm. So that's to stop the endoleaks from occurring. That's what it looks like. So far, 7 patients have been treated by our surgeons. They're followed up using the usual EVAR protocol at 8 weeks, and I'll be following them up routinely from now on. What are we looking for? We're looking for flow into the mesenteric and renal vessels, flow within the limbs, access points for dissection or false aneurysms. Like in the groins, we always routinely look at the entry points. I'm curious about new types of endoleaks, because these sacs will fill up the lumen, but the balloons that are around the new stent grafts, they're quite tough. And if the mural thrombus within an aneurysm sac isn't nice and smooth, there could be potential for little holes being left behind. So I'm curious to see how that works out in the long term. And as far as sac size is concerned, we're not expecting these to shrink down like a traditional EVAR. These will probably stay the same as they are post-op. So just a quick run through my images. We've got SMA, celiac, right limb and the sac, left limb. That's a nice picture. So you've got here the right and the left limb, and you can see the 2 individual sacs that have been filled with this fill, and it's very hypoechoic. But you've still got that rind of mural thrombus that was present in the aneurysm sac before they put this new type of stent in. So no flow, as we should hope. Normal flow through the limbs, normal flow in the renal arteries and access points. So, and that's just the worksheet I've put together for the doctor. So I've made it a little bit different to our traditional EVAR one to sort of show what's going on. But yeah, no, it's going to be something that you'll see more of if this becomes a more popular way of treating patients with aneurysmal disease. The patients that are going to be part of the selection group for this are patients with grafts that begin too close to the renal arteries, for aneurysms that begin too close to the renal arteries for the traditional EVAR, and if the surgeon doesn't want to go ahead with a fenestrated AAA. Patients who may be at high risk of developing endoleaks with large IMAs and things like that. I have heard already at this early stage of a complication where the little balloon full of this stuff has popped proximally and gone on to because these stents are placed just below the level of the most distal renal artery. So any proximal extension of these balloons will immediately start to block mesenteric or renal vessels. So already there has been one case of that happening. So I don't know if that was a technical error or a overfill of the balloons with this stuff. It's an interesting sort of a complication. And yeah, I'm sort of curious to see more of these come through. So this is a new way. So if you just get a request form from a surgeon saying, AAA repair or something like that, sometimes they can be a little bit short with their request forms, and you see something looking like this, it's possibly the new Neelix AAA repair. Hopefully you've been getting more information than just AAA repair. But yeah, it's a new one coming on, and hopefully we get to see the long-term results over the next few years. I'll keep it nice and short for you.
Thank you.